Hello, my dears. How are you feeling today? Are you familiar with that feeling when everything seems normal, yet something has subtly changed? As if your body is trying to whisper something to you, but you can't quite make out the words? Especially often, we, people with a wealth of life experience, tend to attribute minor ailments to age. Well, the years take their toll, we sigh. But have you ever considered that some of these seemingly little things could be quiet harbingers of a very serious threat? A heart attack? Yes, exactly. With age, our blood vessels, like old water pipes, lose their former elasticity, and deposits, atherosclerotic plaques, can accumulate inside them. It's like rust and limescale that narrow the pipe's passage and prevent water from flowing freely. Our heart, our tireless motor, has to work under enormous strain to push blood through these narrowed, stiff pathways. And do you know what makes this situation worse? Familiar, often beloved things. Fatty, heavy food. It's like thick sludge that further clogs our pipes. A sedentary lifestyle, like stagnant water in a pond, where everything goes sour. And of course, the habit of brushing off our own body's signals. It's like ignoring the quiet crackling in the wall of a house until a fire breaks out. But I'm not here to scare you. Quite the opposite. I want to give you knowledge that can become your reliable shield. I will tell you about 5 subtle signals worth paying attention to. And I promise, by understanding them, you can not only reduce the risk of a heart attack, but also feel significantly better, more energetic, calmer, more confident. No complex medical terms or inaccessible procedures, just simple, attentive care for yourself. Stay with me until the end, and let's learn together to listen to the wise clues our body gives us. The first such signal, which often goes unnoticed, is not just ordinary fatigue after a workday or household chores. No, this is a different kind of fatigue, deep, pervasive, as if someone took out your battery and forgot to recharge it. You wake up already feeling exhausted, simple tasks drain all your energy, and your only desire is to lie down and do nothing. Sound familiar? What should you do if you notice such debilitating fatigue? The first piece of advice is simple. Replace the thought, "I'm just getting older," with the thought, "My heart might be struggling," and don't postpone a visit to the doctor. Let me tell you Michael's story. Michael was 68 years old, and he had loved gardening all his life. It was his passion. But for the last few months, he started noticing that after just 10-15 minutes of working in the yard, he felt completely drained. Not just tired, but utterly exhausted. He used to be able to dig in the earth for hours, but now even weeding a couple of flower beds felt like a heroic feat. He got angry with himself, grumbled that he was falling apart, blaming it all on age and bad weather. His wife, Emily, saw how upset he was, how his beloved hobby was fading. "Michael," she said, "maybe you should go see Dr. Brown, just for a checkup." He brushed her off. "Oh, what's he going to tell me? That I'm not a young man anymore? Just a waste of money." Inside, fear gnawed at him. What if it really was something serious? It was easier to pretend nothing was happening. But this fatigue felt so foreign, so wrong. It robbed him of joy. Eventually, Emily persuaded him. And what do you think? The examination showed that Michael had early signs of ischemic heart disease. His heart, working overtime to push blood through narrowed vessels, was overloaded, like an old engine trying to pull a heavy trailer uphill. Hence the monstrous fatigue. All his energy was going into this overwhelming task. It wasn't just aging, it was his heart crying out for help. The doctor prescribed Michael small doses of supportive medication and advised him to change his diet. Less fat, more vegetables, and absolutely daily leisurely walks. At first, Michael grumbled. He didn't like the restrictions. But after just a couple of weeks, he felt the difference. The fatigue began to recede. First, he could work in the garden for half an hour, then an hour. His old enthusiasm returned. He started enjoying his roses and tomatoes again. Psychologically, he came alive too. The fear vanished. Confidence returned. Physiologically, his heart received the necessary support. The load decreased, and it no longer had to work to exhaustion. What's the benefit for you from this story? If you feel unexplained, prolonged fatigue that prevents you from living your usual life, don't ignore it. It's not a whim or laziness. It might be a signal that your heart needs help. This fatigue is like a red warning light on a car's dashboard that lights up when something is wrong with the engine. Pay attention to this signal. A quick checkup with the doctor can save you from major problems in the future and return your energy and joy of life. Don't brush yourself off. Just like fatigue, another symptom that often creeps up on us unnoticed, and which we frequently disregard, is shortness of breath, dyspnea. No, I'm not talking about when you've run a sprint or lifted a heavy wardrobe. I'm talking about shortness of breath that appears with completely ordinary, minor exertion. For example, you climb to the second floor via the stairs and need to stop to catch your breath. Or you walk quickly to the shop and find yourself gasping for air, or even just talking on the phone and you feel like you can't get enough breath. Familiar situation. The advice here is replace the usual "it's age, shortness of breath is normal" with "why is my body lacking air during normal activity?" I want to share Eleonora's story. She was 72 and had always been proud of her activity level. She loved walking in the park, visited friends on foot. But lately, she started noticing that even short distances were becoming increasingly difficult. The walk to the mailbox, which used to take a minute, now required a break halfway. Climbing the stairs to her apartment turned into an ordeal. She was ashamed to admit it even to herself. She began avoiding walks, going out less often, citing bad weather or fatigue. It seemed to her that this was simply an inevitable consequence of age, and she felt old and frail. It was a very unpleasant feeling that soured her mood and robbed her of confidence. Fortunately, her daughter Jane, who visited once a week, noticed these changes. "Mom, why are you breathing so heavily just walking down the hall? You used to fly," she asked with concern. Eleonora initially brushed it off, but Jane insisted on a doctor's visit. During the examination, it turned out that Eleonora had signs of mild heart failure. Her heart wasn't pumping blood as effectively as before, and when she started moving a bit more actively, her lungs and muscles weren't getting enough oxygen, hence the shortness of breath. It's like trying to inflate a large balloon with a tiny weak pump. You'll huff and puff, but the balloon will inflate very slowly. Eleonora's heart was that weak pump. The doctor prescribed her therapy, recommended special breathing exercises and light physical activities. Eleonora was skeptical at first, but decided to try. And the result amazed her. Gradually, day by day, breathing became easier. First, she could walk to the shop without getting short of breath. Then, climb to her floor without stopping. She started walking in the park again, meeting friends. The feeling of lightness and freedom returned. Physiologically, her heart received support, blood circulation improved, her lungs started getting enough oxygen. Psychologically, she stopped feeling frail, her former confidence and cheerfulness returned. She realized it wasn't just about age, but a specific problem that could and should be addressed. What's the benefit for you? If you catch yourself getting breathless from the slightest effort that used to be easy, don't just attribute it to your years. Perhaps your heart is signaling that it's struggling to pump blood. Shortness of breath with minor exertion is like an SOS signal from your body. Pay attention to it. Talk to your doctor. Sometimes small lifestyle changes or properly selected therapy can dramatically improve your well-being and restore ease of breathing. Allow yourself to breathe deeply. Besides fatigue and shortness of breath, there's another signal that is often misleading: pain. But not the classic kind you see in movies, sharp pain in the left chest. No, with heart problems, especially in older people and women, pain can appear in completely different, unexpected places. It might be an aching pain in the lower jaw, similar to a toothache, or a pulling pain in the neck, shoulder, more often the left, or between the shoulder blades. Sometimes it can feel like discomfort, pressure, or burning in these areas, especially occurring during physical exertion or stress. My advice: if you experience unexplained pain in your jaw, neck, or back, especially related to exertion, replace the thought "I probably caught a draft" or "it's osteochondrosis" with "could this be a signal from my heart?" Listen to David's story. He was 70 and was convinced he had dental problems. Periodically, the left side of his lower jaw would start to ache. He went to the dentist, who examined him, took an X-ray. Everything was fine. "Maybe you chilled a nerve," the dentist suggested. David shrugged and decided it would pass on its own. The pain came and went, but he noticed something strange. His jaw started aching more intensely when he walked quickly or climbed stairs. He thought it was just a coincidence. It never occurred to him to connect the jaw pain with his heart. He was used to thinking that heart pain only occurred in the chest. He felt slightly uneasy, but tried not to dwell on it. One day, during a walk in the park, the jaw pain became quite severe, and it was accompanied by a slight feeling of nausea and shortness of breath. He sat down on a bench, and after a few minutes, he felt better. That evening, he told his wife, Helen, about it. And Helen had just recently read an article about atypical heart problem symptoms in the elderly. "David," she said worriedly, "are you sure it's not your heart?" They wrote that pain can radiate to the jaw or neck. David initially dismissed it, but Helen was persistent. She practically forced him to go to the hospital emergency room. And she was right. An ECG and other tests showed that David had serious problems with his coronary arteries. The jaw pain was so-called referred pain. Why does this happen? The nerve pathways from the heart and from certain other body parts, jaw, neck, arms, back, run close together and can cross in the spinal cord. The brain sometimes gets confused and misidentifies the source of the pain. It's like having crossed wires on an old telephone. You dial one number, but get connected to another. The same happens here. The signal about the problem comes from the heart, but the brain hears it as pain in the jaw or neck. Thanks to Helen's vigilance and timely medical attention, David received the necessary treatment and prevented a major heart attack. He was shocked to realize how close he had come to danger by ignoring the wrong pain. Now he listens much more attentively to his body. What's the benefit for you? Don't ignore unexplained pain or discomfort in the jaw, neck, shoulders, or back, especially if it occurs or worsens with exertion and subsides with rest. It might not be muscle strain or osteochondrosis. This wandering pain is like a secret code from your heart that needs deciphering. Don't hesitate to tell your doctor about it, even if it seems unrelated to your heart. It's better to be safe than sorry. Your vigilance could save your life. Listen to these unusual signals. The next little thing that deserves close attention looks quite different. It's swelling, edema. Have you noticed that your shoes feel tight by the evening and deep marks from your socks remain on your ankles, or rings on your fingers suddenly feel tighter? Perhaps you think, I probably drank too much liquid, or it's hot today, or I ate something salty. But if swelling in your legs, ankles, or even hands becomes regular, it could be a serious signal. My advice: if you regularly notice swelling, replace the thought it's just water retention with why is my body struggling to eliminate fluid? Could my heart be responsible? Let me tell you about Susan. She was 65 and always took care of herself. But in recent months, she started noticing that by evening, her ankles became somewhat swollen, puffy. Shoes that fit perfectly in the morning started to pinch by evening. She saw the marks from the elastic bands of her socks that took a long time to disappear. At first, she blamed the heat and the fact that she sat a lot while knitting. She tried to drink less water, avoid salty foods, but the swelling didn't go away, and sometimes it even became more noticeable. It was unpleasant to see her legs like that. She felt heavy, clumsy. It worried her a little, but she didn't think it could be related to anything serious. During her next routine visit to her primary care physician, she casually mentioned the swelling. "You know, doctor, my legs swell up by evening, probably from the heat." But the doctor took it very seriously. He carefully examined her legs, asked questions about other symptoms, shortness of breath, fatigue. Then he referred her for an ultrasound of the heart, echocardiography. The results showed that Susan had signs of reduced heart pumping function. Her heart wasn't working efficiently enough to pump all the blood back from her legs to the center of her body. Because of this, some fluid was retained in the tissues, causing swelling. It's like having a weak pump in your basement. It can't pump out all the incoming water fast enough, and the water level slowly rises. Similarly, Susan's heart couldn't handle the full volume of blood, and the excess fluid accumulated in her legs. The doctor prescribed Susan medications that helped her heart work more effectively and remove the excess fluid. Susan was surprised at how quickly she felt relief. The swelling began to subside. Her legs felt light again. Her usual shoes stopped pinching. The feeling of heaviness and stiffness also disappeared. Physiologically, her heart received support. Blood circulation normalized. Excess fluid left the tissues. Psychologically, She felt immense relief and gratitude to the doctor for his attentiveness. She realized that the swelling wasn't just a cosmetic issue, but an important symptom that couldn't be ignored. What's the benefit for you? If you notice regular swelling in your legs or ankles, especially worsening towards the evening and not resolving after a night's rest, don't brush it off. Swelling can be a visible sign that your heart pump is working intermittently. Be sure to tell your doctor about it. Timely diagnosis and treatment can not only get rid of the unpleasant swelling, but also support your heart, preventing the development of more serious problems. Don't let excess water hide important signals from your body. And finally, the last signal for today, the fifth one, which is particularly common in women, but can also occur in men, and which is easily confused with digestive problems, is an unexplained feeling of stomach discomfort, nausea, or a sensation similar to heartburn, but not directly related to eating. Sometimes, this can be accompanied by a feeling of fullness in the stomach, even after a small meal, or sudden nausea, especially during anxiety or physical exertion. The advice here is, if you are bothered by unclear stomach problems or nausea that don't respond to usual remedies, replace the thought "I ate something wrong again" or its nerves with "could this be related to my heart?" The story of Margaret, who was 75, is very telling. She began to notice that she periodically experienced an unpleasant sensation in her upper abdomen, resembling either heartburn or indigestion. Sometimes she felt nauseous. She blamed fatty foods or her nerves. She had been worrying a lot about her grandchildren lately. She bought over-the-counter heartburn remedies, drank chamomile tea, tried to eat a bland diet. But the discomfort returned, sometimes completely unexpectedly, for example, when she walked quickly or even just tidied up the apartment. This worried her. She was afraid she was developing gastritis or an ulcer. She felt insecure, constantly listening to the sensations in her stomach. One day, she read an article in a women's magazine about how heart attacks in women often masquerade as stomach problems. The symptoms described in the article, discomfort in the epigastrium, pit of the stomach, nausea, sometimes shortness of breath, seemed very familiar to her. She got scared, but decided not to delay. She made an appointment with a cardiologist. After an examination, which included an ECG with stress testing, it turned out that her stomach problems were actually a manifestation of angina, heart pain due to insufficient blood supply. So why did her stomach hurt? Again, because of the proximity of nerve pathways. Nerves running from the heart and the upper part of the digestive tract can send signals that the brain interprets as stomach problems. It's like if an alarm went off in the apartment next door, but it sounds like it's coming from your own. Margaret was prescribed treatment that improved the blood supply to her heart, and the stomach discomfort and nausea disappeared. She was amazed by this connection. She had suffered for so long, taking stomach medicine, while the problem was somewhere else entirely. Physiologically, the treatment normalized her heart function, and the false signals to the stomach stopped. Psychologically, she felt immense relief and confidence because she now knew the true cause of her malaise and received appropriate help. She became an example for her friends, telling them how important it is not to ignore atypical symptoms. What's the benefit for you? If you are troubled by persistent stomach symptoms, discomfort, heaviness, nausea, heartburn, that respond poorly to usual treatment or occur with exertion, don't rush to blame only your stomach. This discomfort could be a mask hiding heart problems, especially if you are a woman. Talk to your doctor about it. Mention the possible connection to your heart. Don't let this disguise fool you. Paying attention to such signals can help identify the problem in time and take action. Listen to your body in all its manifestations. So, we have discussed 5 little things, 5 quiet signals that can warn of heart problems: unusual fatigue, shortness of breath with minor exertion, pain in the jaw, neck, or back, swelling in the legs, and unexplained stomach discomfort. Perhaps some of this sounded familiar to you. Please, don't be frightened. Knowledge is not a reason for fear. It's a reason for action, for more attentive and careful self-care. You have lived a long, rich life, accumulated a vast wealth of wisdom and experience. Your body is also a wise advisor, speaking to you in its own language. And you, more than anyone, deserve to feel good, energetic, and confident at any age. Age is not a sentence to illness and ailments. It is a time when you can and should live a full, joyful life. Listen to yourself. Don't brush off the signals your body sends you. Remember the stories of Michael, Eleonora, David, Susan, Margaret. Their attentiveness, or the attentiveness of their loved ones, helped them recognize the problem in time and avoid great trouble. Small steps towards your health today can give you many years of active and happy life tomorrow. Please, take care of yourselves. You deserve it. Your health and your well-being are in your hands. Be attentive and stay healthy.